most famous physical therapist on the internet.
You calm now? Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Because we are the most famous physical therapist on the internet.
In our opinion, of course, Bob.
Brad was getting all fired up before we were talking about something else.
But we don't want to go off onto that
That's
story.
right. Today we're talking about 3 stretches to help you. Three stretches to reduce hip pain.
There you go.
And Brad, you came up with this, but I agree with you 150% if that's able or allowed.
They say it on sports all the time.
That's right. They give 150% effort. But by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free upload every day. Also, join us on our social media channels and our website, bobandbrad.com. Go to our giveaway section because we are always giving away stuff. Right, Brad?
Dozeology Weighted Blanket for those people who find comfort and allows you to relax and sleep better when you have that extra little weight. 15-pound blanket.
I couldn't say it any better myself.
There you go.
Way to go, Brad.
And you can go to the YouTube or the
Bob and Brad Facebook page.
On the Facebook and click on the little thing there.
Instagram, Twitter. You can join us anywhere. So,
okay,
Brad,
hip pain. One thing you want to check if you're having hip pain is check your range of motion. So many times a joint that is painful because the range of motion has been limited for one reason or another. And if you can regain that range of motion, the pain oftentimes drops.
Absolutely.
So
it's such a simple fix. Right. Why not try it?
Exactly. You can do it at home. And first of all, we're going to show you how to test for it. You know, check your range of motion.
You can see whether or not you actually are tight on one side versus the other.
And then we're going to show you 3 stretches or actually more than 3 options to correct it.
By the way, it's possible though that you could be tight on both sides too.
Well,
so you may want to try the stretch even if they're equal.
Right. That's a good point. That's a good point. But one way or another, we don't know that for sure. So this is a pretty good way to get started. So this is where the people are saying, "Quit babbling."
All right, let's go.
Sorry about that. At least we're trying. We're working on a little self correction or whatever. Okay. So if you want to look at range of motion, hip flexion, in other words, knee coming up to your chest. One way is a nice way to do it is lay down on the floor. You could do this in your bed actually, and you're going to check right knee. You can do right or left knee first, but you're going to bring your knee up towards your chest. You can grab here and pull and see how far it comes up. Now, if it comes way up to here, it's guaranteed that's normal.
Right.
But if it comes up to here and it's tight or it hurts and about right to there, and then you check the other one, and boy, that one comes way up to here. This one only comes to here. Obviously, you have a loss of range of motion. Unless you had a hip injury or if you had a total hip replacement, we're going to ask
you. can't be doing any of these.
Right. Then you got to see your therapist. Be safe with that.
The point too, Brad, can be made is that a lot of times, not only visually do you sometimes see one go further, you get a feel for one being tighter.
Right.
Sometimes like this one will go up right about like there, and this one goes right about there, but it just feels tighter too.
Yep.
So
exactly.
get a sense of that also.
Yep, that's a good point. The next one is hip extension, or in other words, it's the other direction. And this you do need to be up on a bed. And you can do it off to the side of the bed.
Don't fall off the bed.
Right. So I ask my patients, I say, bring your hips to the edge of the bed, but not your shoulders.
Right. Keep your shoulders on.
So you're kind of at an angle here. And I like to bring this knee up, and you can actually hold it here. I like to keep it here for stability. And then just let this one drop down. And see how you can see the lines on my.
He's looking at extension. How much is the leg extending downward?
Right. If you drop it down and it's here, you may not know that if you're not a therapist.
Right.
But again, turn over and check the other one. Here, my knee is above it. The other one, it may drop down to here.
And like if you grab this one and pull it towards you, sometimes that pulls this one up a little bit, and that shows again how tight that hip is.
Right. Exactly. So take your time with it. You may have someone help you out and be watching to see, because it's hard to see on your own body unless you got a mirror on the wall or something of that nature. So that's extension. Now the other direction is going to be figure 4 stretch.
Sure.
Oh, I can do it here. I'm sorry.
You can do it here. You can also do it in a chair.
Yep.
I'll show it on the chair.
So you'll start, I call this the hook line position. You'll start here in your bed, again, around the carpeted floor. I'm going to check my right leg first, my right hip first, take my right ankle, put it on my left knee like this. And the way you'll know it's tight is if I can bring my knee this direction, I can go that far. Or, some people have a hard time even getting it up to here.
Exactly, even trouble getting it into position.
Okay, I'm going to mention it one more time. If you had a hip replacement, don't do any of these.
Yeah, don't do any of these.
Okay, and then you'll check the other side. So if this side, I can bring my knee to here, and this side, I have a hard time getting it up, or it's there. This side's tighter. I'm going to have to work on that. Bob, do you want to show them on the chair?
Yeah, you can do this on a regular
position?
chair. So this is an easy one to see too quite often because it's the same thing. Sometimes people have trouble even getting their leg up there.
Sure.
But you can go up like this and you can see how high the knee is, how far it goes down.
Yep.
And then I'm going to do it on the other side. And yeah, if you're up like this, you're obviously tight. And I'd say I'm pretty close. I'm a little tighter on this one.
Yeah. I am a little tighter on one side than the other too. And I really like this stretch.
Yep.
I do it every morning when I put my socks on in the seated position.
Oh, do you?
Yeah, it's quick. It's easy to do, and I'm there already anyways. Put my sock on.
I do that stretch every morning too. I do it up on a rail, but it just works really well.
See, everyone's got their own thing.
Yeah, their own thing. Okay, you're going to show the stretches, Brad?
Sure.
Now?
And it's kind of nice. The stretches are the same as the test.
Right.
So it's we're going to go through this pretty
easy
quick.
to do.
There's a couple little things, little hints that we know. If this is a tight hip, I'm going to go like this, pull here, and I can stretch. Now, if you can end up getting the stretch here, and it's like, oh, it's stretched pretty easy, make sure you finish it off and take the other leg and flatten it out, and that'll make a little bit more of a stretch there. And if you're having a hard time reaching around your knee, which some people do, it's not uncommon, you can take a towel roll or a belt, and you either can put it around the outside of your knee so you can hold on to here to do the stretch, or underneath the knee here. Now, when you do these stretches, you can do the stretch on, and this is for all of them throughout the video. It's pressure on, pressure off at about that cadence, 10 repetitions. Or if you want to hold it and just relax, think about your breathing, whether you're doing the pressure on, off, or the hold, and really relax, breathe deep, exhale. And when you exhale, it's a good time to put a little more pressure on it. And then you can do that 15 up to 30 seconds and do that 2, maybe 3 times if you'd like to. It depends on when you're started. So that's the flexion one. The extension one, now there's a couple ways to do this. You can just use gravity, go off the edge of the table like we did before.
And remember again, shoulders stay on the bed.
Notice my right shoulder is not even close to being off. You don't want to tumble off the bed and holler at Bob and Brad.
Right.
And right now I'm just going to let gravity hold it down. Now my hip this way is fairly stretched, so I'm touching the floor. But if you had a tight hip, it may be up here. And then really think about your breathing and let these muscles, because sometimes people tighten up and they don't let it relax. And once you learn to relax it, it'll just slowly go down.
If you do want to add a little more stretch, do you feel like you bounce, you can pull that one.
Yeah.
And that'll put a little more stretch on it.
Yep. And you'll feel that.
Yeah, you'll feel that.
Once you work with these a little bit, you get to learn your body real well.
And I'll show just real quick, Brad, how you can stretch your hip flexor also kneeling.
Sure, you bet.
You can just, I normally put down a pillow. I won't now because I have a mat here.
Right.
But I'm going to stretch this one right here. I'm going to keep in good posture. I'm just going to lean forward like this. And that really starts pulling on that hip flexor now.
Yeah.
So same thing, you can do pressure on, pressure off, or you can just go ahead and just relax right into it is what I
show them the
do.
wrong posture. Although we did have some information where they did say they actually advocated this for hips.
Yeah, I don't think it's terrible, but to me, this is much better.
Yeah.
This is the stretch that
you may start out forward and then work your way to up tall. And then the figure 4 one.
Sure.
Simply do this. Now, when I have patients do it, I'll have them here and I'll say push on that knee and back and forth. Again, either pressure on, pressure off 10 times, or just sustain it for 15 to 30 seconds, thinking about your breathing, you're relaxing, and just, allow the muscle to stretch. If you've been doing this for a while and you want to get even more, I'll have them take this knee and pull it up this way. And that's more aggressive. That's pretty much what you would say the advanced, I would say that's for more the athlete or someone who's really flexible to do that.
Yeah, and you can also do it in the chair.
Sure.
You can go ahead and just put it, just like Brad said. I think that's how you do it in the morning. Or you said, right? In the
Yeah, that's
chair?
what I said. You got a good memory,
Yeah,
Bob.
so you just go ahead and
For an old
press
guy.
down here. What's nice about this one, you can actually do this throughout the day, even like when you're in your chair.
Yep.
You know, and you get done with some work, you can go ahead and just finish up by giving yourself a little stretch, especially if you have one that tight side.
Right. Now, I probably should have mentioned this at the beginning or halfway through the video, but when you do these stretches, you're relaxing your breathing. If the stretches produce any sharp pain, you're going too much, too aggressive, too much too soon. They should feel a little pain, a stretch pain, but if it gets into that sharp pain or like a knife is digging in, red flag, stop, and do not go so hard. You may not need to stretch it. It may need some other treatment, as a matter of fact.
It's also possible it's just that tight, Brad, that and that you need to ease into it over a period of time and not try to do it all in one day.
It may take a couple weeks to get through
Oh,
some
absolutely. It may take months even to some of this, to really get stretched out.
Something that's really contracted, depending on the history. But Bob, that was outstanding video.
I'm
really
hip.
happy.
I'm hip, baby. I'm hip to it.
Yeah, that's and we got 10 minutes and less than 12 minutes. We're doing better all the time.
All right. Thanks for watching.